Platelet-rich plasma is a small subsection of the plasma, which is the liquid of the blood. If you think about that cells are floating in a soup, plasma is the soup that the cells float in. And the platelet-rich plasma is a small section of that plasma that has a condensed volume of platelets in it. We get platelet-rich plasma by drawing blood and spinning it twice in a centrifuge that is calibrated to get the smallest amount of soup for the greatest amount of platelets. It's for that soft tissue damage, tear, laxity, or inflammation of a joint. I spent a whole lot of time trying to help people get out of pain. And the way we have done it up to now is identifying the areas of pain. And I've used a lot of steroids and still use a lot of steroids in the practice, particularly around neurological issues. But there had to be more, because after a while we were running into a dead end. Regenerative medicine is a way that we can keep people from getting to some of the later phases of their pain that we see all the time. You need the inflammatory process for appropriate healing. So if you stop the inflammatory process with chronic ibuprofen, and that's where you see a lot of people with ligament laxities and ease of damage to ligaments or ease of damage to a joint without full healing, because they've been so dependent on anti-inflammatories. They've usually exhausted the readily accepted methods of what to do, and they're here because nothing has worked so far. We go through what your previous treatment has been. We look at what your other medical health issues are, because there may be some factors there. We look at your medications. Is there any medications that may be influencing the problem, plus or minus? And then we determine, do you have a problem that regenerative medicine can help? And not every problem is reasonable to be helped at this time. We only have so much data that we can reliably say, yes, this is the right thing for you. I guess our real passion is to get them back to a functional level that they're happy with. They may know that they're not going to turn the hands of the clock back 20 years, but if we can get them to a level of function that's good for their daily use, then we're happy with that. And I think if we could get to some people sooner, it would even be more exciting, but we're happy to see the patients when they get to us.